Hello everyone. I welcome you all to today's session, Karona Apni Suraksha. My name is Pani Jinder and I'm a part of Pratham digital team. To tell you, Karona Apni Suraksha is a campaign. It's a communication campaign dedicated to providing correct and reliable information to the last mile. It focuses on bridging the information gap that is prevailing at the grassroots level and connecting community members to health experts and doctors directly to ensure the flow of safe and reliable information. Additionally, the initiative also hopes to relieve stress by providing an open channel to ask questions, discuss concerns, and bust myths. Additionally, we have created free COVID awareness resources, which is available on Pratham Digital website in English and has been translated in 11 regional languages. Please feel free to check them out. We're also launching a COVID awareness course for youth that can be taken up by them. Today's webinar is conducted in collaboration with the Public Health Foundation of India, coordinated by its Health Promotion Division. We have a special guest today on board with us, Dr. Anish Sinha. Dr. Anish Sinha, can you please put on your camera? Yes, thank you. Dr. Anish Sinha completed his MBA from Government Medical College in 2000 and thereafter pursued his MD in Community Medicine. He worked for WHO, NPSC, that is World Health Organization National Polio Surveillance Project India, back in 2004 as State Surveillance Medical Officer, where he worked extensively for polio eradication, routine immunization, new vaccine introduction, MR vaccine campaign, BPD, and AEFI surveillance in Gujarat, Maharashtra, Goa, Uttar Pradesh, and Bihar. He then joined UNDP, that is United Nations Development Program, in 2016 and implemented Electronic Vaccine Intelligence Network in Gujarat. Gujarat was awarded as Best Even Implementation State for exemplary execution in even back in 2017. He also facilitated even implementation in Indonesia. Currently, Dr. Sinha is working as Associate Professor at Indian Institute of Public Health, Gandhinagar. Welcome, Dr. Sinha. Today, we will have a discussion on vaccination drive against COVID-19. Dr. Sinha, I would like to invite you and help us with this.
Thank you very much. Thank you for the brief introduction. And it's important first, and thanks for giving me an opportunity to interact with you all. That I have been working for almost more than a decade for the various immunization programs of our country. So before moving ahead regarding vaccination and all, let's have some background from what COVID is all about, where we have reached, how it started. So just a brief summary of, or we can say the background of the COVID and what vaccination can do from here on to halt the devastation caused by the COVID. So as you all are aware that COVID started from Wuhan in China towards the end of 2019. And it was in India that the first case was reported from Kerala in end of January in 2020. Then we had the cases started in India in the end of March, then April, and there was a lockdown. So what COVID does is basically a droplet nuclei that it spreads through, and it's a respiratory route spreading virus. That's a novel coronavirus. Novel means it's for the first time this virus has been in the human. So that's why it's a novel virus. So novel coronavirus, SARS coronavirus 2. This is the virus which causes, and the WHO give the name of the disease at COVID-19. So this COVID-19 caused by SARS coronavirus, novel SARS coronavirus 2. So what it does, basically the symptoms that initially was there was fever, sore throat, dry cough. These were the symptoms that initially were in the March, April, we were aware that these are the symptoms that is caused by this virus, and which call it a disease called COVID-19. And it's a highly spreading, very communicable disease. It's a highly infectious disease. And so this disease was termed as to be a communicable disease. And the measures that were put in place to handle this COVID, if you remember, like two terminologies, the quarantine and the isolation. Those who got infected were isolated, and the remaining family members, close contacts, they were actually quarantined for a period of 14 days so that the spread of virus can be restricted. So this isolation, quarantine, coupled with the lockdowns, so there was a stringent lockdown imposed in our country from March end to almost entire April, and towards the end of May, the unlocking started, and we saw the increase in cases as the people's movement started. So this was there. So how to control this COVID? Number one, restricting the movement, the COVID appropriate behavior, that we call it as SMS, social distancing, use of masks, sanitation, that's the hand sanitization and all. So this COVID appropriate behavior, and then the cases kept on increasing in our country. We peaked in somewhere around August or September, then the cases started declining. And towards the end of 2020, we had the world got a gift, I would say, in the form of a COVID vaccine. There were many COVID vaccines, at least 4 or 5 in the initial phase to combat this COVID-19. There were 4 or 5 successful vaccines, though there are more than 100 vaccines under trial, more than 27 in the advanced stages. We had a few vaccines available in US, the Europe, and even in India. And there were successful trials of these. And finally, in the December and in the early January, these vaccines were given emergency use authorization. Now, we were already having understanding about the disease, that SMS, social distancing, mask, and sanitization of hand is effective in controlling the spread of this virus. Also, lockdowns, though lockdown comes with a heavy price for the economic part of it, but then that was also to a certain extent an instrument to prevent the spread of the disease. However, this vaccine became a powerful tool, and we all were hoping that once the vaccine gets available, we will be able to contain this virus. We will be able to save the precious human life. However, our vaccination, globally, the vaccination drive started with the developed countries in the US and European countries in the December 2020. In our country, we started in January. It was on 16th January 2021 that the vaccination drive started, and because ours is the biggest, or you can call it the world's largest immunization drive in terms of number that we have to cater to. So we started well, I would say, but the advantages India had in terms of its experience of massive immunization drives of the polio, the measles rubella campaign, the cold chain infrastructure that is there in the country, our immunization drive was actually not that ramped up as it should have been. So in other words, we were not immunizing large number of individuals on a daily basis. So we somewhere lacked for one or the other reason, though we started immunization and in January, but only it was in the March that our drive picked up. There were some challenges in terms of vaccine hesitancy, some challenges in terms of vaccine availability. And what happened in March, that though our immunization drive was going on, but it was too slow. Hardly we could vaccinate around 15-16 crore in March, towards the end of March, and hardly less than I would say less than 2% at those who were given 2 doses of vaccine. And we could see, because the number of vaccinated was too less, people became complacent, even the authorities became complacent. We started gathering. We failed to follow COVID appropriate behavior. And the result we saw in end of March, April, and May, the devastating second wave, where the almost more than 2 lakh people lost their life, with the daily peak of cases crossing 4 lakhs per day. So again, now thankfully that has come down, the second wave, but this is still not the end of COVID. Only I would say COVID vaccination and the COVID appropriate behavior can save us, or can save this world from future upsurge in COVID cases. So now there are this COVID vaccination, not only in our country, in different countries, but in our country also, we have been seeing that there has been some challenges in terms of vaccine acceptance, confidence, or there are isolated pockets of vaccine hesitancy also. So we'll have to overcome all these challenges and ensure that a significant number of individuals get vaccinated. What the government also targets to vaccinate almost all population by end of this year, by December 2021. Though it's a mammoth task, but nevertheless, we should make an attempt to do it. Only this can save us from future upsurge and save this humanity from destruction because of this COVID disease. So with this background, I think we can now start the questions, take up the questions that you all have.
Yes, Dr. Sinha. So we have youth on board with us here today. I would request, yes. So I would request, starting off with our participant from Hyderabad, Raja Lakshmi. She's the mentor leader. Raja Lakshmi, can you ask your question? Can you please switch on your camera?
Yes, madam. Yes, madam. Good afternoon, sir. I'm from Telangana. I have one question, sir. Should pregnant and lactating women take COVID-19 vaccination, sir?
Yeah, see, it's a very good question. And a lot of deliberations are going on in this at various levels. So before coming to this, let me just explain that this, the global world was, the entire community was under huge crisis. I would say it was a humanitarian crisis globally. So in a record possible time, within less than 1 year, we have a vaccine which could be administered. But these trials were done on individuals who were above 18 years and generally up to 60 years. So what we could, data that we have is these vaccines are safe and effective in the people in age categories and group of individuals where these trials were done. So it is safe and effective. So you must have heard that this vaccine is to be given to all those who are 18 years and above, and to be administered. So whom not to be administered is the children who are less than 18 years of age, because the trials have not been done. It's not that this vaccine is dangerous for them, but we don't have safety or efficacy data. Similarly, these trials were not done in the pregnant women. So as of now, this vaccine cannot be administered to women who are pregnant, simply because we don't have data. But the good thing is the deliberations from the technical groups, the professional body, that is the Federation of Obstetrics and Gynecological Society of India, and the technical task force of the government of India are doing deliberations, gathering evidences whether this vaccine can be given to pregnant women or not. As of now, the government of India guideline says it cannot be given to a pregnant woman. The second question was the lactating mother. Now, initially, these vaccines was not to be given to lactating mothers also, but recently, almost 1 month back, with the evidences available now that this vaccine is safe for lactating mothers and even that safe for the breastfeeding child. So this vaccine can now be given to a lactating mother, but still we will have to wait for the pregnant women unless some data is available and the government allows it for the pregnant women. So lactating mothers, it's to be given. Pregnant women will have to wait.
Okay, sir.
Thank you.
Thank
Thank you,
sir.
Dr. Sinha. Yes, actually, she had another question which was around this only. Does the fetus or the baby get affected once the lactating mothers get vaccinated? So you've addressed the question. I hope Rajalakshmi, you're good with it. Then we have Revati ji, who joined us from Hyderabad. Revati ji, can you please switch on your camera?
Yes, ma'am.
Yes.
Yes, ma'am.
Yes. Please ask
Sir,
your
good
question.
afternoon, sir. I am Revati from Hyderabad, sir, Telangana.
Yes, please ask the question, Revati.
Sir, with the onset of the third wave, children are at a greater risk, no, sir.
So this is again
So
a very
when can we expect vaccination for the children then?
Okay. So there are two questions. The third wave, where the children are going to be more affected, and when we could expect the vaccine for the children. See, the number one, third wave, nobody can very precisely predict, but definitely looking at the second wave, we must prepare ourselves for the third wave. Now, there is technically no evidence available to say that children will be more affected in the third wave. So if we continue our COVID vaccination, if they ramp up that, and if we follow COVID appropriate behavior, that is social distancing, use of mask and hand sanitization, we may definitely prevent third wave also. So each and every individual's responsibility is to ensure that we follow all this and prevent the third wave. Now, even if suppose third wave occurs, it doesn't mean that the children will be at a greater risk, but because the number of cases was too high in second wave, so accordingly the proportion of children were also more in numbers. But if you look at in terms of proportion, in numbers they were more, but if you look at terms of proportion, they were not too high compared to the first wave. So there is no as such evidence to say that children will be more affected. But of course, if you look at the viral diseases epidemiology, if you will vaccinate, suppose all adult population or a large majority of adult population, if gets vaccinated and only children below 18 years are not vaccinated at all, so definitely they will be at certain greater risk of contracting the disease. So that risk is there. But still, there is no evidence to conclude that they will be more affected. But certainly we should be cautious and protecting them. So when we could, the next question was when we could expect vaccine for children. Now, in US and European countries, this Pfizer vaccine has started administration to children between 12 to 18 years. So in our country also, this one of the vaccine, Covaxin, have started their trials for children between 2 to 18 years. So once, and this will not be a big trial like the initial trials that were there. This is a smaller trial they will be selecting few children and they will be vaccinating, making two groups and doing the trials on them for children between 2 to 16 years at 4 to 6 different sites in our country. And hopefully we will be having some data within 2 months, and it will take at least 2 months for vaccines to be available for our children.
Thank you, Dr. Sinha. Revati, do you have any other questions?
At present, not it, no?
Yes, thank you. Then we have Rubia here, who is an Anganwadi teacher. She's from Mysore city. Rubia, can you please switch on your camera? Yes, thank you.
Good afternoon, sir.
Good afternoon.
My name is Rubia from Karnataka, Mysore. Sir, my question is, my mom had angiogram, sir. On few years back, she is taking insulin for diabetics. Is safe to take the vaccine for, sir?
See, a very good question. So your question is that your mother had angiography done, and then she also has a diabetes.
Yes, sir.
Now, so who should not be vaccinated? First of all, let's look into that, then we'll come to this question. So all should be vaccinated, except what I said is children below 18 years and pregnant women. And who should be, see, a person who has heart ailment and a person who is diabetic are at greater risk of contracting COVID and complications of COVID. If you remember, the people who had comorbidities like diabetes or heart ailment diseases, they were more at risk of severe disease from COVID, and even the mortality, the death due to COVID was higher among this population, those who had comorbidities like diabetes or heart disease or blood pressure. So if you remember, the priority group of Government of India's in terms of vaccination, the topmost priority was the healthcare worker, because the priority was to save the healthcare system, followed by frontline workers, then those above 60 years of age, then those between 45 and 60 with comorbidity. Comorbidity means those having any other disease like diabetes, hypertension. So if you look at your, and then it was open to all those above 45 years category, and then open to all 18 plus. So it's more important, people who are suffering from other disease, they should get the vaccine on priority, because if you don't take the vaccine, there is a very greater risk that the person may develop get COVID infection, and then the disease will be very, very severe. Once you take the vaccine, even see, we all have to be very clear that this COVID vaccine, you may even get COVID infection. Some people will get COVID infection even after taking the vaccine, but the severity will be very low, and the person will not be required to be hospitalized. They will get recovered at home with with some limited medications, and the hospitalization will not be required. Death can be prevented. So I would certainly recommend that your mother should go for vaccination. Whichever vaccine is available is good for that, for your mother, and it is safe, and it is very much needed also.
Sir, my second question is, COVID vaccine is one time in life and we have to take yearly, sir?
Now, this is again a very, see, we have to understand that we are struggling a humanitarian crisis. So, and this trials were not, actually the trials are still going on of these vaccines. So you must all have heard about the word emergency use authorization. The regulators have given emergency use authorization, and it is not a complete license, because complete licensing requires 1 or 2 years for the processes to complete. So how long will the immunity be provided with this vaccine? The two vaccines which are being used in India at the moment is Covaxin and Covishield, and third one is added recently, that is Sputnik. And all these three vaccines are 2-dose schedule, but we don't know how long it will provide immunity as of now, because only time will tell. See, we started vaccination since January. So we can certainly say that now it's 5-6 months have passed. So 6 months at least it provides. But there are some scientists who have said that at least this will provide immunity for 1 to 2 years. But then this time will tell, see how the disease progresses, how the those candidates, individuals who are enrolled in the trials, every month their antibody titers are being tested. So based on that, we can say. So to answer this question is too early now. We will have to wait, but certainly minimum protection will be at least for 1 year. That's certain.
Okay, thank you, sir.
Thank you.
Thank you, sir. Thank you, Rubia, for your question. Sir, we've got a question on YouTube. The ship is called asking that my parents got infected with COVID in second week of April. When should they get vaccinated? The government guidelines says 3 months after you recover, but should it actually be 3 months or can it be earlier?
Yeah. See, the government initially there was different thoughts and the guidelines were not that clear initially, but now government has come up with a very clear guide. See, this is emerging science, so every day things may change and people shouldn't get confused or shouldn't blame the government that every 15 days or every week they are changing the guidelines, because the guidelines are to be framed in the light of emerging new evidences. So the current evidence suggests that if you are infected with COVID, so the enough antibodies are produced which will protect you for at least 3 months. In general, it's 3 to 6 months. So you need to take vaccine only if you after post recovery of your COVID, 3 months after your post recovery. Because if you take early, there will not be any good to you. Secondly, because already antibodies are present in your body, and if you inject the vaccine, which we call it as antigen, the immune response may not be optimum. So the antibody level that should be after vaccination may not be that optimal. So it's always good to wait for 3 months and then go for the vaccine.
Thank you, sir. I hope Kshitij in the YouTube audience got his response. Then we have Praveen Kumar. Praveen ji, can you please turn on your camera? Praveen ji?
Madam, from the host side, it has been disabled.
Just a second.
Yeah.
Just a second, I think.
Hello, sir. Good afternoon.
Good afternoon.
Yes.
Yes, sir. My question is, there are 2 to 3 vaccines already. You said that nearly about hundreds of types of vaccines are available. So presently in India, so we are aware with Covaxin and Covishield maximum. So the person in that area, if he get the Covishield for the first time, so after 3 months for the second dose, if that vaccine is not available, can we take other vaccines such as Covaxin or something? So that means a mixed vaccine we can take or not, or else it may affect our health. So that doubt many people will be having. So what's your clarity regarding that, sir, please?
Yeah, so this is again a very good question, because it's the first time in our country that we are seeing for one disease there are multiple vaccines.
Yes,
and these vaccines are based on different platforms. The technologies are different. The components that they have used are different. The mechanism of actions are a bit different from most of them are different. So this was not there with the already existing disease vaccines that we have in, like for polio or diphtheria or tetanus. There you can take any vaccine, whichever is available. They were all based on the same platforms and all. So, but here it's different. So as of now, there are 3 vaccines available, and you have to take the same vaccine 2 doses, because the efficacy, what is claimed, like they claim the efficacy for Covishield, if for 3 months or 12 weeks of duration, 12 to 16 weeks of duration of gap between the 2 doses of Covishield, the efficacy of the vaccine means the level of protection that it provides is more than 80%. For Covaxin, it is 79% if you take 2 doses 4 weeks apart. For Sputnik is 91% if you take 4 weeks apart. So this efficacy depends on after taking the full dose only. So full dose here is the 2 doses of the same vaccine. Now, if you take 1 dose of one vaccine and say that second dose for the second vaccine, as of now, we should not do. as there are now studies are being approved in US, UK, and even in India, what we call it as mix and match. One dose of this vaccine, second dose of this. We'll have to do a trial and see if they are safe and they are able to produce good antibody levels. So then only it will be approved. As of now, we should not do, because we don't know whether it is safe or not. So we don't have any safety data. We don't have any immunogenicity data of mix and match of two vaccines. So currently we should not do. We have to take 2 doses of the same vaccine. And believe me, the policymakers do understand these issues. So I don't think there will be any shortage of any of these vaccines.
Nice clarity. Thank you so much, sir.
Maybe just to add to, maybe that if you go today, they may say that, oh, we don't have that vaccine. Can you come 2 days after? So that may be the only scenario. Otherwise, there will not be any shortage of any of these vaccines.
Fine, sir. Then one more question. So while providing the vaccine or injecting the vaccine, the frontline workers will be indicating that after taking the vaccine, we should not consume alcohol for the alcoholic addicts. So it might be the problem. So like that they will feel. So after how many days they can consume alcohol? If they consume the alcohol immediately after the vaccination, is there any side effects for them?
See, if you ask me, alcohol should never be consumed, neither before vaccination nor after vaccination.
So that is a doubt in the society. So that's what I'm just.
So I would say, see, now we don't have. So suggest when somebody asks you, tell them no, alcohol should never be taken.
Yeah. For that. Okay.
But definitely, see, I am not exactly aware of this, but certainly, see, after what happens with the vaccination, there is an immune response generated in the body. So you must have heard that some people after getting vaccinated get fever, headache, mild pain, but that lasts only for a day or two. Some may get severe. I know one person who got very high grade fever for 24 hours. So these are possible. These are very rare cases. So these may be possible. So if you take alcohol and all, I think this may get aggravated in that scenario. So it should be avoided to the extent possible. As far as immunity and all is concerned, I don't think the alcohol will interfere with the development of immunity and all. But because these adverse events are the minor adverse events that occur after vaccination in certain individuals, we don't know in whom it will occur. So they should avoid at least immediately for 2-3 days at least. And if possible, should avoid it permanently. This is an opportunity if someone asks.
That is right message, sir. Thank you so much.
Thank you.
Thank you so much, Praveen.
Yes, ma'am. Thank you.
Yes. Then we have Vimla ji with us. Vimla ji, can you ask your question? Vimla ji, you are on mute.
Hello, sir. Good afternoon, sir. I am from Bangalore, Karnataka. My question is, some of the patients don't get tested officially for COVID. So if they take vaccination before 3 months of their recovery, can it affect them in any way?
Yeah, see, getting tested is also not that easy at times, particularly in rural areas and all. At the time when the second wave was at its peak, getting testing done was difficult. And we have to understand there is a large majority of people who are asymptomatically infected, means they are infected but do not have any symptom. So if they take the vaccine, see, they don't know actually they are infected or not. So if they are positive, they are infected, they should not go for vaccination, wait for recovery and then go after 3 months, should go for a vaccine. But people, if they don't know, like asymptomatic cases, they will not be aware that they are infected, and everybody can't go on testing before vaccination. That is not possible. That should not be done. So if they take the vaccine, as such, there will not be any harm. Only thing is the antibody response which should be that might be slightly less than if they were not infected. Otherwise, there is no issues of health, or it will not affect any health, like it will not further aggravate the COVID disease and anything like that. So they should not worry. If they have taken the vaccine, it's perfectly fine.
Thank you, sir.
Sorry. Yes. Sorry, we have a question from our YouTube. It's been asked by Dina Ji. If I already had COVID-19 and recovered, do I still need to get vaccinated with a COVID-19? Do I still need to get vaccinated? Yes.
Yes, it is very important that you get the vaccine still after you get recovered. See, when you got the disease, there is no, the disease was a natural thing. And there are two things. First of all, we don't know what was the level of infection and all. So we don't know what level of antibody would be there in, it would have been produced. And secondly, the immunity or the antibody that develops following the natural infection may be short-lived. But with the vaccine, what happens? There is a calculated dose of antigen, or the vaccine is injected in individual that produces an immune response where good cell-mediated and antibody titers are produced. So it is very, very important that even those who have been infected with COVID and recovered should take the vaccine 3 months after recovery and take both the doses. There are some myths that people say we should take only one dose. So they should, but ideally they should go for both the doses of whichever vaccine they get, either Covishield, Covaxin, or Sputnik, whatever they get, but take both doses of the vaccine.
I hope you got your answer, Veena. Then we have another participant here. So Verna-ji, can you please switch on your camera? Yes, thank you.
Hello, sir. I am Suvarna Khedekar from Pune. I have one question. If someone is vaccinated already and then gets COVID, even goes to the hospital, so what are the chances of them getting back fungus after they become COVID negative and come back to home?
Okay, so those who have taken COVID vaccine, first of all, what are the chances of them getting COVID disease? Number one. So what we call those who have taken COVID vaccine, and if they get COVID disease afterwards from infection, that is called a breakthrough infection. So in whatever data that we have till now for this, though still these studies are going on, so whatever data that we have is suggest that breakthrough infection of around 0.3 to 0.4% only. So you can call it as 3 to 4 individuals per 1,000 who are vaccinated may get the infection. Now, majority of those who get COVID after getting the vaccine will not require hospitalization. They will have a mild disease and they will recover at home. And these vaccines are almost 100% efficacious in preventing severe disease. However, there may be isolated instances where somebody may require hospitalization, but then again that severity will be less. So if they're less severe, so the severity will not be like they need a ventilator and all for longer duration. So majority will not require hospitalization. A very few number, maybe 1 or 2, or rarely 1% may require hospitalization, and that too will be of shorter duration. So what we have seen, black fungus occurring in those who have been long stay in the ICU, who has been diabetic, who has been on steroid for a longer treatment, because steroids is one of the treatment for the COVID. So those who have been given steroid for longer duration in higher doses, those who are diabetic, those who have been in the ICU, those who have been in the hospitals for longer duration, they are at greater risk of black fungus or the mucormycosis. So those who are vaccinated will ideally not require hospitalization. And even if require hospitalization, that will be for a shorter duration, maybe 3-4 days. And so the risk of getting black fungus will be definitely lower than those who are not vaccinated.
Okay, thank you, sir.
Thank you, Savanati, for asking the question. Yes. So the next participant is Anuja. Anuja, are you there on the phone?
Yes.
Yes.
Good afternoon, sir. So my question was, one person after taking vaccination in my neighborhood died. And since then people started believing that it happened because of the vaccination. So is it true? If not, then how can we make them understand that?
Yes, again, this is not the first time that we are seeing with the vaccines. We have seen this with all vaccines, maybe measles, rubella, or BCG, or oral polio, everything. We have seen that if there is something untoward incident occurs immediately after the administration of the vaccine, the community blames the vaccine directly. So first, understand what mechanism do we have. Any adverse event following immunization, that we call it as AEFI, adverse event following immunization, that is any untoward medical occurrence that occurs after vaccination are to be reported. There is a standard mechanism to report. There is a state government, central, district committees are there for this AEFI, and there is a national level secretariat at Delhi for this. So all AEFI are reported. This death must also have been reported in that. And then there are standard procedures to investigate. If required, the samples are also tested. If post-mortem is important if it is done, because that will also reveal what were the antecedent causes of death. And only that technical committee can say whether, because then we will have all documents also, whether there were any pre-existing illness. हो सकता है ना कि उनको कुछ और बीमारी हो, like the person might be suffering from a heart disease or congenital heart disease, something like that. So vaccine was only a coincidental thing. So only after detailed investigation we will able to confirm. So we have to wait for that. Postmortem, if it was done, is very good. That will help us in arriving at a situation or whether it's vaccine or not. In such scenario, to convince people, we should use like, look, thousands and hundreds of people have already taken the vaccine. Nothing has happened. And if the vaccine was to be blamed, in one vial there were 10 vaccines. Why only one death occurred? If the vaccine was not good, if there was any problem with the vaccine, then why only one
death occurred?
There should have been more, at least 2-3 if the vaccine was not that good. There is 10 dose vial. In one vial, there 10 people are vaccinated. So why only one occurs? So these are the things which are which help us to conclude that the vaccine is safe and is not responsible for this incident. Though this is unfortunate. So this is one of the reasons that those who are sick people, we say, wait for that person to recover. Because if they are already sick, we will vaccinate. If something happens, they will blame the vaccine and the community will again start refusing to take the vaccine. So that is why is one reason that when somebody is sick, we say that wait for 1 to 2 months or wait till the person recovers and then we will vaccinate.
Thank you, sir.
Thank you. Thank you so much, sir. That was a great response from your side. It will help us also in communicating further to our community. Today, we have Tushar and Samida who joined us from Pune. Tushar, Samida, can you please switch on your camera? Yes, thank you.
Hello, sir.
Hello.
Good afternoon, sir.
Good afternoon.
Myself, Tushar from Pune.
Yes.
And myself, Samida from Pune.
So my question was, what are the side effects of vaccine for different ages?
And why it is so that
Just can
some
you
people
repeat? There was your voice was broken. So please repeat.
My question was, what are the side effects of vaccine for different ages?
Okay.
and my question is, why it is so that some people show side effects of vaccine and some don't?
Okay. So what you are basically it's related to side effects. See, what in vaccine terms we use the word AEFI, adverse event following immunization, and these minor, and if there is a death or if there is a hospitalization after vaccination, we call it a serious AEFI. So what we'll be talking about the minor AEFI or the minor side effects that occurs. These are not age related, but in general we have seen those who have got this vaccine may get fever, pain at the injection site, headache, letharginess, things like the person feels that everything has become very slow. So, and some may even have nausea, vomiting. So these are the general some common side effects that people get. And out of 100 vaccinated, hardly 1 to 2 or 1 to 3% may get this, either 1 or 2 of these symptoms. And everybody don't get, because everybody body's compositions are as different, and whenever there is an immune response in the body, some may get some this immune response means because the vaccine is a foreign body, is an antigen injected into the body, it stimulates the immune system of the body to produce antibodies and memory cells. And that many times, because of this process, the body temperatures are raised, and which is evident in terms of fever. Some may get some headache. So everybody don't experience this, but few may get 1 to 3% population, those who are vaccinated may experience 1 or more of these adverse events.
Okay, thank you, sir.
Thank you, Samada. Thank you, Rishad. Yes. So we have yes. So we have Stephen here with us, who's a software engineer. Stephen, can you please switch on your camera? Yes.
Hi. Hi, sir. Good afternoon.
Good afternoon.
Sir, my question is, vaccine is for increasing of immunity only.
Yeah.
So other than this vaccine, we have other ways to increase immunity, like immunity boost are there. Some natural ways also there in market. So in this both, which is better one?
No, the immunity boosters and vaccines are different. See, immunity boosters are in general. Like, we know if we eat healthy food habits, if you have natural food, if you have enough of vegetables, fruits, pulses, then there are some immunity boosters. So these all will help you boost your immunity or help you to gain the immunity. But vaccines are directed towards development of antibody against a specific antigen. So the COVID vaccine, what it does is, once it is given to an individual, it generates immune response to produce antibody, and these antibody will be present in our body once the person is fully vaccinated. And in future, if the coronavirus enters the body, these antibody will fight against and kill those viruses. And there are also memory cells created in the body, which will also stimulate antibody production in a larger quantity in the event if there is any infection with the coronavirus. So, and vaccines are basically producing antibodies and protect against that specific disease. Whereas immunity is in general. See, those who have a healthy food habits are generally they generally don't get sick so frequently. They are more energetic. So these are all general. or if you take these immunity boosters will help you in, if you get fever, still you may not feel that much, or you will not be that you will not feel that sick even if you are there. So these are the benefits of general immunity that you develop. But vaccination develops a specific antibodies, protective levels of antibiotic against a specific disease.
Okay. After taking vaccination, I heard one word that till 14 days, if you test in 14 days, it will get positive report. Is that true, sir?
No, absolutely wrong. It's not, because see, what test we do for COVID is the RT-PCR test. So, because again, there was a similar question from one of my neighbor. He had to travel to Mumbai for a treatment purpose, treatment of a different disease, but he had to travel there to Tata Memorial Hospital, and then he was also that if I take the vaccine, it will be detected positive and I will not be allowed to travel. So it's nothing like that. This RT-PCR test, the original virus, the wild virus of SARS, novel SARS coronavirus 2, and vaccine is a different virus. It's only a spike protein that it generates. So this will not be tested positive once, even if you take the vaccine. So if you are tested positive in RT-PCR, you are definitely infected with coronavirus. Vaccine has nothing to do with that results.
Thank you, sir. Thank you.
Thank you, Stephen. Sir, we have a question in the YouTube audience. They're asking if a person has already got his first vaccine dose, and after some days they've got infected with COVID, they're COVID positive. So after how long do they need to get their second dose after recovery? Is it like the same time period or is it different?
See, again, we have to remember, like we said, for the ones, anybody who has got COVID positive, they should recover, and after recovery, 3 months post recovery, they should get the vaccine. This applies for the first dose also, and it is same for the second dose also. So somebody has taken first dose, after say 15-20 days he gets infected and from the COVID virus, and then he gets he has to recover. So once it recovers, then again he has to wait for 3 months post recovery for the next dose. It even for the Covaxin or the Covishield or the Sputnik, it remains the same.
Okay, okay. Thank you, sir. We have one of our participants on the call, Archana. Can you please switch on your camera? Archana is from Pune.
Yeah, yes, ma'am.
Yes, yes. Can you please ask your question?
Hello, sir. Myself, Archana Garud from Pratham, Pune. I have one question. What are the precautions one should keep in mind after taking vaccination? Are there any specific precautions to be taken by a BP or a patient with diabetes?
See, again, a very good question. See, for most important, those who have been taking, those who have been suffering from diabetes, hypertension, or any other long-term ailment or chronic disease that we call, should continue to take their medicines. They shouldn't stop that, oh, tomorrow I have to take the vaccine, so I will not take that diabetes medicine today, or I will not take hypertension because it may interfere with the immunity, and also it's nothing like that. Those whatever medicines those people have been taking on a regular basis should continue to take that. So number one. Number two, those going for the vaccination shouldn't go empty stomach. They should have some, if you are going in the morning, should have breakfast. If you're going in the afternoon, should have lunch. So don't take the vaccine empty stomach. Some people, because if they take empty stomach, may get giddiness and all. So it's important that they shouldn't take the vaccine empty stomach. You should continue to taking all the medicines that you have been taking before, during, on the day of vaccination. Also, you should take all your regular drugs if you are anti-diabetic or anti-hypertensive drugs, and even after the vaccine also should continue to take this medicine. So these are the precautions that need to be taken.
Thank you, sir.
Thank you, Archana ji. Yes. So is there anyone else who wants to ask any questions on the call? Yes. Please go ahead, Kavita. Can you please switch on your camera?
Yes, ma'am.
Yes.
Yeah, good afternoon, sir.
Good afternoon.
Myself, Kavita. My question is, if we take vaccinate during menstruation period, will it get any effect for women?
Again, this is a myths which have been circulating, like they shouldn't take the vaccine during menstruation. The vaccine, the response will not be that good, or it will have adverse effect on the menstruation also. But these are all myths. There is no science involved here. These are two independent things. So you can definitely go and take vaccine even during menstruation. That will not have any adverse effect on either of the two. Neither vaccine will have adverse effect on menstruation, nor menstruation will have any adverse effect on the vaccination process. So this is absolutely a myth, and we should encourage females to even go for vaccination even in their menstruation periods.
Thank you, sir.
Thank you, Kavita. So in addition to what you said, sir, would you like to mention a couple of such myths that should be considered that are getting revolved on social media, which people are believing? Would you like to talk about such myths and clarify them?
So almost we have received, one is this menstruation that's going on. The second is those who are having comorbidity should not take these vaccines. There's another myth or the wrong notion that people have developed, that those who are having allergy should not go for the vaccination. Now, allergy means what has been mentioned in the vaccine, those who have severe allergy or anaphylaxis. Means now somebody having allergy with the dust. So that's not contraindication. That person should go for vaccination. But somebody who was given some drug, the person fainted, needed to be hospitalized for 4 or 5 days, and then could recover. In that scenario, only vaccine is whether it's to be administered or not, need to be evaluated. So severe allergic reaction or anaphylaxis, if this is there, then only we have to be cautious and take medical advice before taking the vaccine. Other all allergies with the clothes, with the dust, with the pollens and all, there is no harm in taking the vaccine. We should go ahead, rather we should go ahead with the vaccine. See, unless significant number of people are are vaccinated, we will have third wave. So it's important that we all, and what we call as like each and every, like we have experience of pulse polio. We could make our country polio free because of that only vaccine. So if you are able, if we want to prevent future waves, and second wave has actually shown that no family was untouched. Yeah. It went to every houses. In fact, there were deaths almost in every 5th or 6th or 10th house, I would say.
Yeah.
So if we don't want to repeat that, the only thing that can save us is this vaccine. And of course, still a significant number means, what I mean to say by significant, because to vaccinate 130 crores by even 100 crores by December is looking very difficult. But even if we vaccinate 70 to 80 crore population by December 2021, we will be very happy. Even if third wave comes, then the magnitude will be very less. It will not be that disastrous as it was the second one was. So we must encourage all to allay their myths and come forward to take the vaccine. Some people, this is mainly from the a more educated class, that the vaccines doesn't produce desired level of antibodies. But the antibody titer or antibody level is not, and this elite class have not been taking vaccine because of this reason, that it doesn't produce enough antibody levels after vaccination. But see, antibody levels are one thing. There are cell-mediated immunity also, which helps in making memory cells. The memory cells are made in the are already there after the vaccination, and they will mount the fight once the natural virus person gets infected with the virus. So the antibody titer, you shouldn't go for that. I would say I have not tested my antibody titer. I have taken both the doses of vaccine. In April, I got COVID also, but I never. It was a very mild. Was cured in the house, with home isolation itself, and even then I didn't monitor didn't measure my antibody titer. It's not required. Don't go only for the antibody titers. Take the vaccine. It will definitely protect you. And our mission is that at least 60-70% population should get the vaccine by December. Only then we will be able to prevent or avert the third wave.
You're right, sir. In fact, like we are also at Pratham we are organizing health webinars, which are around the same, to burst myths and misinformation which are being circulated around, and people are believing such myths. So we are about to. Yes.
Yeah, just to add to this, the myths around vaccination is not new for the COVID. This was there for the polio. This in the Western UP, in the Malegaon, in Maharashtra, Bhiwandi, Western UP, some parts of Bihar, some parts of, and isolated in many parts of the country. See, whenever this any vaccines, even with this COVID vaccine, there was some religious angle that was also being tried to give in the initial. There were religious issues raised for the polio vaccines, for the measles rubella campaign that was conducted 3-4 years back in the nationwide mega campaign that was done. I could remember even the media also coming up on day one of the campaign. It was launched and day one of the campaign, all leading newspaper that measles vaccine causes autism, the front page. And after some discussions and all, because that, and they also quoted this article in one of the reputed international medical journal, but they didn't say that the same journal retracted that article after few months. So they published this, and when the retraction, once we discussed with them that this has sent a very wrong message to the community, so the retraction or the rebuttal that you call, that was in a very small font and somewhere inside the pages. So these all do happen. The myths, there are vested interest, but we should understand vaccines are only for the good, and whichever vaccine is there, it's always beneficial in preventing the disease.
There was another question which was being asked. There are 3 vaccines. Which one is the best vaccine out of all?
So can anybody say? Do you think anyone? What is your take? So there are 3 vaccines in our country now: Covaxin, Covishield, and Sputnik. So which one we should go for?
Anyone on the call?
Sir, Sputnik, I think so.
Okay. So from which place you are? I think you are from Pune.
Yeah.
So so Sputnik, I don't think at the moment is there in Maharashtra. It's basically.
So the next is Covaxin, sir.
Okay. So see, a very simple answer, and you all should always remember this. The best vaccine for COVID at the moment is whichever is available to you the first. जो भी आपको सबसे पहले मिल रहा है ना, वही सबसे अच्छा है. Because all these, see, our priority is preventing severe disease, preventing death. And all these vaccines are highly efficacious, almost 100% in preventing severe disease and death. I have seen one of my colleague, he was adamant he needed Covaxin. Covaxin to mila nahi, but काफी severe disease हुआ in this second wave to that person because he was adamant he want only Covaxin. Covishield was freely available here, but he was waiting for Covaxin. He got disease. It was with great difficulty that a hospital bed was arranged for him. I'm sure you all must be available everywhere. It was the same situation in April and May this year in the second wave. The drugs were not available. It was with great difficulty. First of all, we arranged a hospital bed, then for the drugs. And now he says, sir, आपकी बात मान लिया होता, it would have been better. बोला कोई बात नहीं, अब तो जो हुआ. But then I gave his example to all in my institute that see. So now nobody asks me which is the best vaccine. So best is whichever is available. After 1 year, when the COVID will be very like normal disease, see, COVID is not going to go, and enough different vaccines are available, then we will decide which is better. Today we have to deal with the crisis, and what we have seen is all these vaccines are good, I would say excellent in preventing severe disease and deaths. So whatever is available, take that vaccine.
Thank you so much for clarifying that, sir. I think we've had a great session, informative session, even for me, and I am pretty sure everybody on our YouTube who has joined us as an audience and here the participants on the call must have got a lot of clarity on so many things. Thank you so much for joining us today, sir. Thank you so much. And is there any last message you would like to give out to our youth who are about to begin our COVID course? They're going to be the time, they're going to spread out this message, they're going to help people to get vaccinated, get them registered on COVID. Is there any motivational message you would like to give out to them?
This is the whatever, even if you help a smaller number of people also get vaccinated, it will be a huge contribution in controlling this pandemic. So I wish you all the best. And vaccination is the only tool and the surest tool that we have to prevent this pandemic further causing further damage. And while doing so, see, vaccination is definitely there. I would also request, keep on following social distance, use masks and hand sanitization. These are important. Even if you are vaccinated, even if you are fully vaccinated, taken both the doses, these COVID appropriate behavior need to be followed, and encourage and support all to get the vaccine. And your contribution will definitely be acknowledged at all levels. And in fact, you will be self-satisfied that you have contributed so much in preventing this disease doing further damages.
Thank you so much, sir. Thank you. So we will end this call today here. Soon you will join us in other languages also. Please subscribe to all our channels to be updated to the news and information around COVID and other areas as well. You will, if you want free COVID awareness resources, please check out Pratham digital website. There are there are information available in 12 languages. So thank you everyone for joining. Thank you, Dr. Sinha.
Thank you. Thank you.
Thank you, sir. Thank you so much.
Thank you.